Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Welcome to today's webinar, Understanding the NPMA Health Insurance Exchange. This webinar is presented by Victoria Heron with CWI Benefits and Jerry Lynn Cobb with David K. Young Consulting. My name is Janae Rickwalder, and I will be your moderator today. Before we begin, I'd like to cover a few housekeeping items. First, please use the chat panel located in the bottom right-hand corner of the control panel on your screen. If you need to ask a question, please click on that chat box and type in your request. Then click the Send Privately box and direct your question to me, Janae Rickwalder. We will answer all questions towards the end of the webinar, and if we run out of time, we will definitely follow up with you via email. All telephone lines are on mute for this call, and it is being recorded. If you're an NPMA member, you may access this recording in the Member Center section on our website beginning next week. And now I'll turn the microphone over to Victoria.
Good afternoon, everyone. I'm really excited to be here and to be able to review the enrollment platform that you and your employees will access in order to enroll in the benefits that you end up electing. We'll begin with the landing page. So as your employees log in to make elections for their benefits, this is what they will see. I will review the tabs at the top, and then finally we'll review the enrollment, as that's the most important section. So the news section is completely customizable, and you can put whatever news you would like to communicate to your employees. So if this enrollment is mandatory, you can note that. Also, any other news that you would like to convey to your members, this is a great place to put it. Your employee can then log in and view their personal information. The numbers listed here are for David K. Young Consulting, and they will be able to assist your employees with enrollment and any questions that they may have. This section will also list any dependents that the employee has. Next, they can view the current coverages that they have. They can also view future elections. So if they've already gone through the enrollment and selected their January 1st benefits, they can just log in and review what they've previously elected. Next, and one of the most commonly used, is our links page. This page will allow your employee to access information in the websites for National General, who's providing the medical coverage, Transamerica, who's providing ancillary coverages, David K. Young Consulting, that's going to be responsible for managing the spending accounts, and Discounts by Design. Next, we will have the form section. Here we will put any information that your employees will need to access regarding any plans that you end up electing. The health info is information and tutorials that your employees can use. And again, this can be customized for your group. So something that we want to note about this system is that it is a re-entrant system. So let's say that you decide that you're going to offer your employees 2 weeks to enroll for the benefits that you have elected. Your employees can log in as many times as they would like during that 2-week period, and we will capture the final election that they have entered. Here at the enrollment home screen, you will notice that it gives the member the closing date and how many days they have left to complete it. They can select Enroll Now, and then it'll begin the enrollment. This section is their electronic sign-off, basically agreeing that you will deduct via payroll whatever benefits they elect. It's a very easy system for your employees to navigate. As you can see, you have your navigation tabs right here at the bottom or at the top. Next, it'll give your employees instructions. So if you want to make this a mandatory enrollment, we can note it there. We'll also ensure to have phone numbers listed throughout. So if your employee has questions or concerns, they can reach out to us and we can get that resolved for the member. Next, it will allow them to review their information and ensure that it is accurate. They will also be able to enter their email address. This will be really helpful for you if you ever want to do any mailings to your employees. We will be able to capture and gather this data, and we can provide that to you at your request. Next, the employee can enter their dependents. If you decide to cover domestic partners, we can put any necessary forms or language that is required to inform the employee of what they must do to cover that domestic partner. It is important that the employee enter all their dependents in this section, as our system will not allow them to enroll in, let's say, employee plus child coverage if they don't have an active child listed. So just something to keep in mind. And they can always go back if they need to. Next, we're going to move on to the videos. These are informational videos that can allow your members to gather some more information regarding the spending accounts, whether it be FSA, HSA, or the MyMed RX Saver. After they've viewed the videos, they can continue to the pre-enrollment questions. As we've noted, there will also be Transamerica products that you can select from. If you do select these products, Transamerica does require us to capture whether they use tobacco or not. At this point, the member would make their selection, submit their answers, and move to elect the rest of their coverages. Now, this is the meat and potatoes of the system. First, it'll list the medical plan for the employee. Here, it gives them a brief language regarding cafeteria plan rules and qualifying life event changes if they do need to make those. So here, this employee has elected the employee-only value medical plan. The medical elections will be preloaded for these cases as the member would have already made the selection. So it will not allow them to edit it. If they need to, they will need to call the number listed above. Let's say that you decide to offer an HRA. This is what it will look like, and this is where your member can elect their yearly contribution amount. The same thing goes for the HSA account, or the FSA, or the dependent care spending account. As you notice, it'll keep a tally for the member as to what they've elected so far and what their expected deduction might be. Next, we add some information regarding the free RX discount card program, and that will notify the employee to follow the link on the confirmation page to download the app. Next, we'll move into the Transamerica products. If you choose to offer the term life insurance, this is where the member will be able to make their election for themselves. If they decide that they would like some more information about it, they can access the brochure right from the enrollment website. Next, they will list the beneficiary for their term life coverage. They can list multiple beneficiaries and select the shares and add any special notes as needed. Next, they can elect coverage for their spouse if they have a spouse listed as a dependent. If they do not have a spouse listed as a dependent, it will not allow them to enroll in a coverage that they're not eligible for. Same thing with the child life. And again, if the member forgets what exactly the benefit is, they can access the brochure right from the site. We are also offering hospital indemnity through Transamerica. At this point, they have two options. They can choose from option 1 or option 2. They can reference the brochure if they have any questions and make their elections. May also offer the short-term disability coverage through Transamerica, and it is a flat benefit amount, so they'll just select what it is or waive it. They can also elect cancer coverage. And again, they need to know more about the cancer policy, decide whether they want to enroll on it or not, they can reference the brochures right from the site. Also offering accident coverage through Transamerica. Lastly, you can select discounts by design. Please note that this is not an insurance product, but a discount program, and it's a flat monthly charge of $6.95. So if, let's say you have 26 pay periods, all of the deductions shown will be based on the number of pay periods that you or your group has. They can click here on the left to read more about the discounts that are available, such as pet care, dental access, vision, health advocacy, chiropractic, medical tourism, diabetic supplies, pharmacy discounts, hearing discounts, labs and imaging, vitamins, and emergency medical information. At this point, if your member is satisfied with the elections and the deduction amount for the benefits that they've elected, they can select Save and Continue. Our site will then direct the member to the enrollment confirmation. Lets them know, congratulations, you've completed your enrollment, and below is a list of what you've elected. It will also let them know when the coverage will begin. And as I noted previously, the premium shown will be based on per pay period amount, if that's what you choose. They can also click this link to download the MyMedRx Saver discount program, and they can download the emergency medical information for the discounts by design. And if this were a new hire and had not previously completed the medical enrollment form, they could also access this from this screen. We'll list their dependents again, their beneficiaries for the Transamerica Life product, and they can have this printed or they can email it directly to themselves. So our goal with this system is to ensure that it is easy and anyone in your organization is able to complete this enrollment. Again, if your members ever have any issues, they can contact the number that's listed and we will assist them through the enrollment. And that will conclude the website portion of our webinar.
Fantastic. The next presentation is going to be from Jerry Lynn Cobb, who is with DK Young and Consulting, who is our third-party administrator for this this program. Many of you have probably already spoken with Jerry Lynn, and she is just going to run through a few thoughts and follow up on some of the items that Victoria discussed. And then if you have any questions, go ahead and start typing them into the chat box, and we'll make sure we take care of them after Jerry Lynn is completed.
Good afternoon, and thank you for having me be part of the webinar today. I'd like to share with you some of the exciting benefit offerings that NPMA has put together for their association partners. As you can see, Victoria did a great job in going through the enrollment portal, and the products that we are offering are all listed very explicitly on the portal for the employees when they go through the enrollment. So it's really a good tool for them, and it shows them the things that they need to know. So the first thing I wanted to say before we jump into the offerings that we have is that this is not an all or nothing type product offering. So as you saw previously, there are many different things that are being made available, and this is a pick and choose type situation. So you can actually, if you, like, say you decide that the self-funded medical plan doesn't really make sense for you, you can still go with the other benefits that are available, like the Transamerica products or the discounts by design, and we can set it up for you to where that would be showing on your enrollment portal, and the other coverage would not be showing for your employees. So I'll go ahead and jump right in, and the first thing I wanted to talk about, which I know I've talked to several of you, is the self-funded medical plan that is being made available through National General Benefit Solutions. This is available to groups that meet the standard requirement of eligible employees, and it offers 2 PPO plans along with a high dollar health plan that coincides with an HSA offering. There's also an HRA offering for employers that don't meet the underwriting guidelines or feel that the premiums are too high with the regular plan. There is an HRA that could be something that would be cost effective to you. This allows you to use tax advantage account dollars to pay for individual healthcare premiums or any out-of-pocket costs that your employee or dependents may incur. There are consumer-directed spending accounts, health savings accounts. A health savings account is a tax-advantaged personal savings account that can be used to pay for medical, dental, vision, and other qualified expenses. These funds can be invested, so this is something that employees can actually take and use for investing in retirement as well. There are also healthcare flexible spending accounts made available. An FSA is an employer-sponsored benefit account that allows employees the opportunity to set aside pre-tax funds to help pay for eligible healthcare and dependent care expenses. There's no setup fee or monthly minimum charge for these types of benefits that we're offering. We also offer 125 cafeteria plan administration, and David K. Young's office will create or amend plan documentation at no additional cost. Transamerica is offering a suite of products, and the first one that I'd like to mention is the Trans Select 20 Term Life Insurance. This is term life insurance that provides employees a guaranteed issue death benefit. The premiums are scheduled to remain level for 20 years and are guaranteed level for the first 5 years. It also allows for to choose spouse coverage as well as child coverage. Employees can purchase up to $50,000 for themselves, $30,000 for spouse, and $10,000 for dependent children. The next offering through Transamerica is an Accident Advantage, which is an accident plan that can be used for off-the-job accident insurance to help pay for medical bills and other out-of-pocket expenses such as deductibles and things along those lines. It helps with emergency room treatments and any other insurance out-of-pocket expenses that they may have. Cancer Care Select is a voluntary cancer-only policy that helps defer medical and non-medical costs of cancer treatment. It can provide for chemotherapy, radiation, hospital confinement, transportation, and lodging. The Trans Disability Plus is a short-term income insurance policy that will pay employees a monthly benefit if they're unable to work because of a covered illness or injury. Employees can replace up to 60% of their income up to a maximum of $2,000, allowing them to focus on recovery and getting back to work. Hospital Select. A hospital indemnity insurance policy pays an employee a specific benefit amount for each day that they are confined to hospital or intensive care, and it also pays for a benefit for hospital confinement. This can be used to defray costs such as deductibles and copays as well. Discounts by Design is offering a suite of benefits, and as Victoria was mentioning previously, this is not insurance, but this is a discount arrangement, and they offer discounts on dental. The dental has things such as cleanings, x-rays, crowns, fillings, orthodontics, and periodontics as well. They also offer discounts on vision. And the providers, there are several providers that offer 20 to 60% off prescription eyewear, including framed lenses and specialty items such as tints and coatings. Chiropractic, members can save 30 to 50% on x-rays, diagnostic services, and treatments at over 3,000 chiropractors nationwide. Medical Bill Saver. Medical Bill Saver is a product that can help you with your medical bills. It has experts that know the ins and outs of how billings practices work and attempt to negotiate benefits on your behalf. This can lead to a reduction in the costs. Health advocacy is personal health advocates that will help you navigate through insurance and healthcare systems. They can also help you look for doctors, specialists, hospitals, dentists, and pharmacies. Advocates also research treatments, resolve claims, and provide medical explanations so you can make better informed decisions. There are complementary services on hearing, diabetic services, vitamins, and labs and imaging. There's a nurse line that's available 24/7 where nurses are on call to answer any questions that you might have for non-urgent concerns. The cost for the exchange is $6.95 per member per month. And like I said before, I just want to make this very clear that this is not an all or nothing type benefit offering, and you can take advantage of the benefits that work best for you and your employees. And that concludes the benefit offering.
Great.
Hello?
Thank you so much, Jerry Lynn. Appreciate that. Several of you asked the question if there was a PowerPoint that corresponded with this. No, there is not. All of this information is available on NPMA's website. Jerry Lynn, though, I did have some follow-up questions for you. The first one, from the audience: are all states eligible to sign up for the exchange?
No. All states are not eligible to sign up. There are limitations, and I can help with that. If anybody has questions, if they want to contact me directly, I'm more than happy to let them know if they qualify for the plan.
And it is my understanding that 47 states, though, are eligible. Is that correct?
Yes, that is correct. That is correct. So it's actually New York, New Hampshire, Hawaii, and D.C. that are states that are exceptions.
We have a question from the audience. Could you explain more about how this self-funded medical plan works?
Sure, no problem. So a self-funded medical plan is actually a little different than the fully insured world in that self-funding allows the employer to actually put money into a funding account that is there to fund the claims for their employees. So once a census is received and the carrier determines what the stop loss limitations are and looks at the group's demographics, then they provide the rates that cover aggregate stop loss insurance and puts money into a funding account to allow the claims to be paid out of that funding account. So say a company has a really healthy population and they put in the funding for the 12-month period, and the claim dollars that are expended during that time frame do not exceed what was put into the account, the employer would actually receive funds back at the end of the year.
There's another question here. Actually, I believe I have an answer for this question, but Jerry Lynn, you step in if I am getting this wrong. But as an employer, how do we go about finding out if joining this exchange is a better fit than the health insurance we currently offer? And it is my understanding that you can simply have your broker vet the program for you on your behalf. Jerry Lynn, is that correct?
As far as my understanding was that in order to be part of this offering, it was required to be an NPMA member.
Well, that is correct. But if an NPMA member wants to just confirm that this is a good program in comparison to the insurance that they already have, they can have their agent vet the program.
Yes, that is correct.
What if the claims exceed the available funds for the self-funded program?
That's when the stop loss would kick in, and stop loss is the insurance that protects from higher than expected high dollar claims. And so part of the money that's being paid out every month into the fund is actually going to provide for stop-loss insurance.
All right. Any other questions related to what has just been presented? Give it a minute or two. I do also want to just reiterate that this is a this program, the NPMA exchange it's called block underwriting. So there is a discount that you receive at being an NPMA member using the aggregate number of companies that NPMA represents to receive some discounts on your premiums. There is a process that you have to follow in order to receive your quotes. Jerry Lynn, would you mind providing some information on what that process looks like?
Sure, not a problem. So how it would work is you would contact me, and my contact information is listed on the NPMA website, and I would provide you with the information about what's being offered, as well as include a census form. The census form has 2 tabs that you would fill out and send back to me, which I then in turn turn over to the carrier and receive a quote. Once the quote is received, I turn it back around to the employer group and ask if they would like to set aside a time or if they have questions, and we go through it and go forward from there. So once somebody makes a selection, then what happens next is that I would provide them with a link that would take the employees to a mobile device. You can do it on a mobile device, or you can do it on a computer, and which would allow the members to actually go through and fill out the application for medical coverage.
Great, thank you. One follow-up question. One of our members has asked whether or not we know that National General is the company that supports the block underwriting, but will you explore opportunities with other providers such as Blue Cross, United, et cetera, if that is requested by the member?
If it's requested for a group policy, yes.
Great. And then what is the deadline to join this, comes from the audience?
And that is something that is typically set by the your plan year. So if you already have a plan year, it usually goes by plan year. And we're targeting January 1st as a start date for the majority of these plans.
Any other questions from the audience? Well, we do, like I said, we do have this available on NPMA's website, npmapestworld.org, and there's a banner right on the home screen of the website, so on the home page of the website, so you can click on that and get some more information, as well as a link on contacting Jerry Lynn. I'm going to also send out to everybody on this call Jerry Lynn's direct contact information. Just a quick question that just came in. What percentage of reduced cost compared to my current provider, not an NPMA member? Frank, I'm going to unmute you real quick, so perhaps you can ask that question directly. All right. Going to have to enter the PIN I just sent to you, Frank, and then you'll be able to ask your question directly. If you can't get that PIN working, Frank, I will contact you after the call and we'll get that answered for you. Anything else from the group? Well, fantastic. Thank you, everyone, for participating in today's call. Thank you, Jerry Lynn and Victoria, for giving us all of this fantastic information. we're here to answer your questions and provide you any sort of advice, or I won't provide you advice, but our experts will definitely provide you advice on directions to take, and we look forward to serving you. Again, this is all available on our website, and we are recording this, so it will be available for you to review at a later date as well. Thank you so much, and everybody have a great rest of your afternoon.